So let me end by envisioning what it might be like to actually have a future care a care system that truly addressed the whole person. Here's an example of what we do now, and this is a composite drawn from an individual. This is actually the journey that they had. This is not the person nor their name. They were diagnosed with stage 3 colon cancer. And after the diagnosis, they had surgery, staging, and some genetic testing. The effects were, as is often the case, fear, denial, and seeking out on the internet other kinds of treatments without necessarily good guidance or evidence. They look up the data and are shown that they have a 37% 5-year survival, which, if not managed properly, feeds their fear if they think it applies to them. Then in the treatment phase, they go through surgical debulking and very intensive chemotherapy, which produces bowel dysfunction, immune suppression, neuropathy, fatigue, and early retirement. They gain from this 12 months tumor-free, and if they're lucky, 2 months of life. If they go into remission, they then are monitored with CT scans every 3 to 6 months and increasingly tumor markers. This often causes fear, distress, and anxiety, so-called scanxiety, and depression, as this idea of possible imminent death, which is not imminent, is in their mind. They may have elation if their scans are negative, and gratitude, or depression and PTSD if they're positive. If they do then get a recurrence, they are put on second-line chemotherapy, even though the ability to prolong their life is not there for the evidence, and they may get some increased tumor-free survival at the cost of disability, diminishing quality of life, loneliness, and despair. And then towards the end of their life, palliation kicks in. We have good medications for that now, for pain management and nausea, rehabilitation, but they're often bedridden with pain. And if they don't get good, high-quality palliative care early enough, they will continue to have loss of joy, guilt, regret, and not end with a good acceptance and reconciliation that they seek. This is the normal journey that people like this have today. But what if we actually had both a science and a delivery system that provided whole person care? What would this look like if this was done? And notice I put this in the future because I don't think it's easy to get this, but all of these things are within grasp. They're available. The science is there for implementation. At diagnosis, there are DNA screens and ex vivo sensitivity tests with tumor markers that then help identify the specific combinations of treatment. Thus, you have concern, but you're implementing behavior change and a commitment to see if your individual cancer gets relieved. The chemotherapy may be low dose, especially if it's done in combination and targeted. You might have other supportive things added, like IV herbals or C. You could probably avoid resection because you're now tracking the regression of the cancer and the side effects were mitigated. Real-time adjustment can occur and off of it at home. The hope here is that you now have 87% 5-year survival and have an additional 5 years longer, even after this staging. During the monitoring phase, we can do it with blood, so-called liquid monitoring, and immune markers of the microbiome. And there may be prevention vaccines as options that then keep it at bay during the monitoring session so it simply isn't watch and wait. We know there are dietary changes, exercise and activity changes throughout the continuum of care, and there may be off-label drugs that affect the metabolism in the terrain or other supplements. Thus, there are multiple options, modifications that can help you maintain a routine life. If you have a recurrence, You have the normal types of scans, but now we're actually testing for other things, the so-called hallmarks of cancer, and altering the terrain through things like fecal microbial transplant, which alters the immune system. Immunophoresis and immunotherapies are available with much fewer side effects. Yes, this is inconvenient. Yes, it may be expensive, but it provides hope, and it is concern, not despair, increasing your likelihood of living longer with quality. Finally, we all die eventually, and at the end, if you die of cancer, the palliation might kick in. But the hope is that with whole person care, your social and emotional and spiritual aspect will be upfront and done early, not in the last couple months of life, or even the couple weeks is often the case. There'll be local treatments to alleviate symptoms, things like cannabis and herbs that also can help with quality of life, new drugs, and psychospiritual approaches that help you address some of the fears that this brings. This can be delivered through home care to minimize the pain, minimize the guilt, and let everyone have the final discussion that allows them recognition of their life, acceptance, and a peaceful death. Let me return to this wise quote from Michael Lerner at the beginning. Cancer is not always experienced as the greatest problem facing a person. And I would suggest this last aspect, a peaceful death, which is a blessing that a Chinese blessing, I understand it. May you have a peaceful death, is actually one of the more important things that cancer care should be providing. But if the idea of hope and a peaceful death is continuously disrupted throughout the cancer journey, then we have failed in one of our most important goals in cancer care, bringing hope throughout this journey, not simply the hope that the cancer is eliminated, but the hope that the suffering and the death that is attached to that word is no longer empowered.